We use hip abduction strength testing a lot in orthopedics. And what I want people to know is that it's true it tests the integrity of the tendons and muscles of the glutes, primarily the gluteus medius, minimus, and TFL, but it also tests the integrity of other structures, primarily joints and nerves. So this test, if positive, meaning if it's weak, or it's weak and painful, or it's just painful, doesn't incriminate just muscles. Other things may be causing those positive results as well. So when we do this test, the patient is lying straight on her side, legs are straight with the trunk, not forward, and the leg is lifted into abduction, the hip is lifted, and the clinician applies pressure. For it to be normal, the patient can resist against my pressure without any pain. When it's weak and or painful, that would be a positive test. But then I start to ask, well, why is it positive? Most times I find it's positive because there's a mechanical problem in the hip joint, a mechanical problem in the low back, or a mechanical problem in the SI joint. So we look for that joint problem. We do repeated movement testing, move the back in one direction, retest that hip abduction strength test. Move the hip in one direction, retest that hip abduction strength testing. By and large, I find that hip abduction strength comes back quite quickly. So before I would have someone strap on an ankle weight and do weeks or months of strengthening into hip abduction in side-lying leg raises, I want to first make sure that the reason that test is limited in strength or painful is not because of a joint problem that can be fixed by finding the direction the joint needs and moving into it repeatedly.